This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy!
Dun, 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 dun. Here we go. We are the Berman Method podcast. I am Dr. Jake Berman, running solo today. I hope you guys enjoyed my wife's podcast last week. Very informative. That's what I'm looking for. So if you didn't hear it, go back and listen to it. This week, I've got a very hot topic for you guys. It's been sweeping the nation. I don't know what the heck's going on. Well, actually, I do, and we're going to talk about it. But over the past 18 months, I've gotten more calls, more questions about rotator cuff issues, shoulder pain, impingement syndrome than I've gotten in my whole entire career. So I wanted to record this podcast just to answer the most common questions that I've gotten over the past 18 months and then give you guys some tips. So this is the first time I've ever done this. I actually made an actual outline this morning, so I am prepared. My wife would be so proud of me because I am a wing it kind of guy, off the cuff of my seat pants, or however that saying goes. Let's just run with it. But I actually sat down and wrote a very detailed outline so that I did not miss anything, because there's a lot here. So let me give you an outline of what we're going to talk about today. We're going to talk about the signs and symptoms of a rotator cuff problem versus an impingement syndrome. We're going to talk about the causes of shoulder dysfunction in general, whether or not you should get an X-ray or an MRI, how to interpret your MRI. Do you need surgery if your MRI shows a tear? Should you get an injection? Oh man, that's very popular. The old cortisone injection. So we'll talk about that. Will rest and or ice help? Can you heal a rotator cuff tear without surgery? Ooh, that's exciting. How long does it take to rehab conservatively, meaning not having surgery, versus operatively or post-op? How long does it take to rehab if you do have surgery versus if you don't have surgery? And then we'll end with some simple things to try at home or work right now to help alleviate your shoulder pain or the pinchiitis, whatever we're dealing with. So we got a lot to cover, so let's get into it. And I've already talked about how we've had a significant increased frequency of questions, concerns, pain, people asking us for rehab for rotator cuff and shoulder issues over the past 18 months. And the one thing that I can say is it has to do with what's been going on in the world. Our lives have completely changed, at least for some period of time, where we used to be more active, and generally speaking, there was a significant period of time where we were not as active, hopefully not as much anymore, but there was a significant period of time where our lives were turned upside down. Instead of going out and doing things, we weren't going out and doing things. Instead of going to the gym, we weren't going to the gym. Instead of playing golf, tennis, socializing, we weren't doing those kind of things. So that is what has led to this increased frequency in shoulder issues. And then I'm going to give you a lot more details on why that's happened exactly. So let's start with signs and symptoms of a rotator cuff problem versus impingement problem. So those are the two most common issues that we see in general. When we're talking about if your shoulder hurts, the two most common reasons why a shoulder will hurt is you've got a rotator cuff tear or you've got impingement syndrome. Impingement syndrome simply means that one of your muscles is getting pinched between two bones. Very simple. Don't overthink this one at all. And then the other one is your rotator cuff is torn. So How do we know the difference? One of the biggest differences, and I have to be careful when I say this because you can have this symptom in both a rotator cuff tear and impingement syndrome, but the biggest sign or symptom of a rotator cuff tear is night pain, or most common, biggest, whatever, however you want to say it. But if this shoulder is keeping you up at night, that's leaning more towards a rotator cuff versus impingement syndrome, but it is not completely indicative of it. So you can have impingement syndrome and that shoulder is going to wake you up at night when you go to roll over, or it's going to keep you awake because it's just so flared up. I'm just trying to give you some generalities right now, okay? So another sign, or a sign for impingement syndrome, is you go to raise your arm up, and right when it gets about level with the ground or horizontal with the ground, you get this sharp pinch. It's like, oh my gosh, that's sharp. It's like it's impinging, it's getting pinched. That's more indicative of impingement syndrome. But again, this is a subjective thing, right? So one person might describe it as a pinch and another person might describe it as a dull ache at the same exact range of motion. And it could be the same exact thing underlying. So both of them could have impingement syndrome. One person describes it as a pinch, the other person describes it as an ache. So this is not a end all be all. I'm just trying to give you guys some generalities. So one of the biggest signs of a rotator cuff tear is trouble sleeping. It wakes you up or keeps you awake, more importantly. And then one of the biggest signs of impingement syndrome is you go to raise your arm up in front of you or out to the side, and right when it gets around shoulder height or horizontal to the ground, it just pinches, and it's like, oh my God, that sucked. Okay. What are the causes of shoulder dysfunction? I kind of hinted on it when I first started this thing about the activity level, but the number one cause of shoulder dysfunction, non-traumatic rotator cuff tears, meaning you didn't fall on it, nothing traumatic happened, it just started hurting and led to a tear. The number one cause of impingement syndrome is poor posture. Oh my gosh, that was anticlimactic, wasn't it? How many times have you heard me going on and on and on about posture on this podcast? I don't even know what episode we're on, 25 or 30 or somewhere around there. But I know that I've brought up posture many, many times. And I can tell you, no BS here, all joking set aside, that the number one cause of shoulder pain, shoulder dysfunction, non-traumatic rotator cuff tears, impingement syndrome is poor posture. And the reason why that happens is when you're in poor posture, you've got a lot of muscles that attach to your shoulder blade. It's like 18 different muscles are responsible for stabilizing and rotating and moving your shoulder blade, which gives your rotator cuff and your shoulder joint stability. When you're in bad posture or not ideal posture, it doesn't have to be shitty posture, but just less than ideal posture, those 18 muscles back there are not as efficient or effective at giving support to the rotator cuff and or the shoulder joint itself. So, the number one cause of shoulder dysfunction is poor posture. Dun, 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 dun. Okay. Now this next one, I love this next question. Should you get an X-ray or an MRI? If you did not have a trauma, meaning you didn't fall on it, you weren't in a car accident, you didn't fall off your bike, you didn't run into something like a wall really hard, or nothing traumatic happened, you do not need an X-ray. Reason being, X-rays look at bone. They do not look at soft tissues. Sometimes you can argue that you can see some soft tissues in an X-ray, but you cannot make a sound diagnosis based off of an X-ray when we're looking at soft tissue problems. So when your shoulder hurts, 99.9% of the time, the reason why it hurts is because a muscle or a soft tissue, not a bone, muscle, tendon, ligament, is pathological or getting hurt, whatever it is. That's what's causing the pain. So getting an x-ray will not give you any clear vision or diagnosis or results or information. That's what I was looking for on what's causing your pain. So don't waste your time with an x-ray if you got shoulder pain and it was not traumatic. The other thing is getting an MRI. Everybody loves the idea of getting an MRI. And I'm going to tell you something that a surgeon told me years ago, back when I first was getting into my career. And he's like, man, I just laugh every time a new patient comes in and asks for an MRI. And I say, why? Do you want surgery? And of course, every single person always says, no, I don't want surgery. I'm trying to avoid surgery. And the surgeon goes, so why do you want an MRI? You know, MRI stands for might require incision. Incision surgery, right? And when he said that, I'm just sitting here laughing, going, this is a surgeon saying this to his patients when he gets paid for doing surgery, but he's, honest, he's conservative. He's trying to talk people out of having surgery. And I was like, man, that makes so much sense because pre-MRI, all you know is your shoulder hurts. You don't have a real diagnosis. So you can't put blame on something other than your shoulder hurting. When you get an MRI, whatever the results are of that MRI, you then attribute your pain to. So the reason why my shoulder hurts is because this on my MRI. And then it's almost like a victim mentality. And, this is a subconscious thing that happens. I'm telling you, I've seen this thousands of times throughout my career where it's no longer your fault that your shoulder hurts because my MRI says this, so that's why my shoulder hurts. So why would I waste my time trying to work on my posture, going to physical therapy and doing these pain and torture exercises? They should not be pain and torturous, by the way. The shoulder is the one joint in the whole entire body where we do not work through pain because the structures are too delicate. So we've got to have pain-free movement. You cannot work through pain with the shoulder. You can argue differently post-operative. That's a whole different conversation, but neither here nor there. Back to the MRI, the surgeon's saying, why? Do you want to have surgery? That's what MRI stands for, might require incision. And I'm like, man, that's just genius. If you don't want to have surgery, don't get an MRI. Go to a specialist. Go to a qualified physical therapist or some type of musculoskeletal expert and let them work on you 1 or 2 or 3 times. They should have a really good idea within 1 or 2, 3 sessions whether or not they need further testing. We know in the first 5 minutes whether or not you have a rotator cuff that requires surgery or not. Well, let me say this, asterisk, right? 99% of the time, we can tell you within 5 minutes whether or not you need to have surgery for a rotator cuff, likely rotator cuff tear or not. And we'll get into that here in a little bit. So now let's get into how do you interpret an MRI. Let's say you didn't listen to me. You didn't listen to that one surgeon out of a million that said, don't get an MRI. And you went and got a damn MRI. Now your MRI comes back. And it says you have a tear. Oh my gosh, you have a tear. You got to have surgery. There's nothing you can possibly do. Well, hold on a second. Let's talk about how to interpret the findings on the MRI. The simplest way that I was taught to do this in my last internship and my first rotation, or my first real job, was when you're looking at an MRI, scroll down to the findings section. Every MRI report has a findings section, and this is where they essentially summarize what happened. Findings are impressions. Man, I'm spacing out right now. It's the last section, so it's either findings or impressions. Whatever the last section is, it should be shorter word-wise than the section just above it, where they're going in a lot more detail. And I look for 3 words in this section, impressions or findings, whatever the section is. And the 3 words are mild, moderate, and severe. So when I see the word mild, I don't even consider it. It's like, okay, you're normal. You're aging normally, because I could take an MRI of an asymptomatic person, somebody that has no pain at all, and their MRI will come back and say mild this, mild that. When the word says moderate, that's when I say, okay, it could be indicative of something going on that's causation or correlation with what your clinical presentation is, or it might not mean anything at all. It just has to match the clinical presentation. And then severe. When I get an MRI report that says severe tear of the supraspinatus, for example, I'm like, okay, that thing needs to be operated on, because we're not rehabbing a severe tear. And I'll get into a test at some point in my little outline here on how you know if you need that. Very simple. Take you 10 seconds to do it. So anyways, that's how I interpret an MRI. Mild, moderate, severe. If it says mild, I don't even consider it. It's irrelevant. It means nothing to me. If it says moderate, it may mean something, but it does not mean that you have to have surgery yet, right? It's got to be consistent with your clinical presentation. And then severe is when it's like, okay, there's something going on here. All right. I hope that helps. Now, do you need surgery if your MRI shows a tear? You should have a kind of an idea based off of the last 2 or 3 minutes of what I was just saying about mild, moderate, severe. But let's get into this. If it says you have a mild tear of the infraspinatus or supraspinatus, whatever, it doesn't really matter what the muscle is. If it says mild tear, you don't need surgery. Rehab the thing. Rehabbing it conservatively will be much easier, less painful, less more cost effective than if you have surgery on that. And generally speaking, surgeons are not going to make you have surgery if it says mild. Moderate tear of the supraspinatus or whatever muscle, you might need to have surgery, but it's highly suggested that you try at least 6 weeks of quality physical therapy, not cookie cutter physical therapy. Don't go to some freaking place that is seeing 3-4 patients an hour and you just get handed a sheet and you go get on the assembly line and go do a bunch of BS exercises without any type of specialist looking at you, telling you that that exercise is not being done 100% correctly. That does not count as going to physical therapy, attempting conservative treatment. I don't know if you can hear the tone changing in my voice, but my freaking blood pressure is raised through the roof right now when I hear of this, where I tried physical therapy and it didn't work. Okay, well, tell me, what did you do? Well, I went to Cookie Cutters R Us physical therapy, and they were seeing 3 to 4 patients an hour. They handed me my sheets. I went through the exercises. It hurt. It sucked. I tried it 3 times a week for 6 weeks, and it didn't work. Okay, I'm sorry, but you wasted your freaking time because you were doing it wrong the whole time. Every exercise has to be done 100% correctly, or it's essentially wasting your time, because if it's not done 100% correctly, it's not taking the appropriate stresses off of the structures that it's trying to rehab. So again, I said it earlier, when we're rehabbing the shoulder and you're doing shoulder exercises, they should not hurt. If they're hurting, you got to tell us. You got to tell your specialist that you're working with. There is a difference between pain and exercise-induced burning fatigue, right? So we do have to make sure that we're on the same page as far as what your definition of pain is. But in general, it should not hurt. You shouldn't say, yeah, that hurts. And then as soon as you stop whatever exercise it is you're doing, that should go away. Because if that's, what is it called? I wish Jenny was here right now. Man, lactic acid buildup, and that burns. I can call that pain sometimes. When Jenny is kicking my butt, making me do a shoulder exercise, and we're doing as many reps as possible for 4 minutes, I get 2 or 3 minutes into that, and my shoulders are burning so bad, I sometimes consider that pain. But it's not pain. It's exercise-induced lactic acid building up, and that burns. It's different. So anyways, let's come back to where I was off on a tangent there. Do you need surgery? We talked about that. I think now is where I'm supposed to tell you about that simple test. Yeah, do you need surgery? This is where we talk about the test. So this is the first test that I do with anybody that thinks that they have a rotator cuff that requires surgery. And this is when I was telling you earlier in the podcast that I'll tell you in the first 5 minutes whether or not you need surgery or not. So here's the test. It's called the shoulder shrug test. I'm pretty sure you can Google it and you can see a video of it. Super simple. When you're standing up with your arm straight, go ahead and reach it out in front of you, trying to raise it up over your head. And if you get to about shoulder height, so again, parallel with the ground, and then you can't go any higher without shrugging your shoulder blade up into your ear to raise it up, that's called a positive shoulder shrug sign. That is most likely indicative of requiring surgery. However, not completely. That's why I said 5 minutes, not 5 seconds. So the other option is you go and you raise that shoulder up. We were talking about this earlier, and it starts hurting right at shoulder height, but you can kind of work through it, but you don't have to shrug your shoulder up to keep raising your hand up. It just hurts like hell. That usually means that you don't need surgery. So again, a positive shoulder shrug sign is really leaning hard towards needing surgery, but we've got to spend a couple of more minutes assessing the surrounding structures just to make sure that it's not just getting bound up somewhere and it just needed to be released. And then after doing that, you can actually raise your arm up without shrugging your shoulder up. So that's the easiest thing that you can do to see if you need surgery. Just stand in front of the mirror at home and raise your arm up. When you get to shoulder height, do you see your shoulder start to shrug up towards your ear to keep raising your arm up towards the ceiling? That's a positive shoulder shrug sign. Okay, moving on. Should you get an injection? Oh my gosh, this freaking question drives me nuts. The shoulder is the one joint in the whole entire body where I try to steer everybody away from getting an injection. And the reason why is because when you get an injection, it usually works. And when I say works, I'm meaning it takes the pain away. There's a reason why the pain is there in the first place, because something ain't right. Now you get an injection, it takes the pain away. You start to do motions with that shoulder that you wouldn't normally do because it used to hurt pre-injection, but now it doesn't post-injection. So you keep pushing through an area that used to hurt but doesn't hurt anymore, further grinding down those soft tissues. What the heck does that lead to? Further degradation or degeneration of the soft tissues, making it more likely that you're going to have surgery. What the heck? Come on, guys. Just because the pain is gone does not mean the problem is fixed. So I can honestly tell you that at least 90% of the people that I've come in contact with over the years who had an injection in their shoulder ultimately ended up having surgery. That is no BS. And that's for the reason that I just got done harping for the past 2 minutes. When the pain's gone, you do movements that you wouldn't normally do. That further degenerates the tissues, which makes it more likely that you're going to have surgery. So come on, guys. Think about it. Pain is there for a reason. Don't take the easy pill. The injection is the easy pill. Pain is there for a reason. Little asterisk or side note, blue light special, however you want to say it. There is one place that I do encourage having an injection in the whole entire body, and that is for hip bursitis. When somebody has a true hip bursitis, it is extremely difficult to get that hip bursa to calm down because you have to use it with every single freaking step. So that is one time in the whole entire body, one diagnosis in the whole entire body where I will actually encourage getting an injection, because after the injection, it'll at least allow us to spend some time working on the reasons why the hip bursa flared up in the first place. So Anyways, I digress. Let's get back to my handy dandy outline here. Will rest or ice help? Short term, yes, it might give you some immediate relief. Long term, absolutely not. There's a reason why the thing is hurting in the first place. Again, we're talking about non-traumatic, meaning that just started hurting for no reason. If it just started hurting for no reason and you quit moving it, that's rest, or you ice it to decrease the inflammatory process, yeah, it's going to feel good temporarily, but I guarantee you, you're going to do that frickin' motion again and flare it up again. So temporarily, rest and ice will help, but it's not going to fix the problem. It's going to come back. Can you heal a rotator cuff tear without surgery? I think I talked about this earlier. If it's a minor tear, yes. If it's a moderate tear, maybe. We just got to assess the situation. We've got to put a very diligent 6 to 8 weeks of work into it with perfect homework, not with cookie cutter USA PT physical therapy clinic that is not focused on perfect. And we just got to attempt it. If it's severe, we're not rehabbing a severe tear. I mean, you're not going to heal that. That needs surgery. How long does it take to rehab conservatively versus postoperatively? I love this question. It's going to take about the same amount of time. If you have surgery, it's going to take you a minimum of 6 rotator cuff surgery. So they go in there and they repair a rotator cuff tear. It's going to take you a minimum of 6 months, sometimes 12 months to get back to normal everyday function. If you have impingement syndrome, it could take you 6 months, 12 months to rehab that thing to where you don't know that you have a shoulder issue. It really depends on what caused the problem in the first place. If we go back to the first thing, what's the most common cause of shoulder issues? It's poor posture. If your posture is that bad, it could easily take 6 to 12 months to reverse your postural or your posture issues and to alleviate the stresses that are put on the shoulder joint. Also, there's 17, 18, 19 muscles that need to be addressed when relieving or rehabbing the shoulder joint. So that just takes a while. The biggest difference between rehab done conservatively versus postoperatively, meaning conservatively means you never had surgery. You're trying to avoid surgery. You're not going to have the scalpel treatment. Versus rehabbing after having the scalpel treatment, it takes roughly around the same amount of time to recover from both. But the biggest difference is the amount of pain that you go through. So when you have a rotator cuff surgery, the first week after surgery is absolute hell, from what I hear. I have not had a single patient over the years that did not say that the first week after rotator cuff surgery was an absolute hell. You can't sleep. You're trying to sleep in a recliner. There's really no position of comfort. So you're essentially going sleep deprived for a week, and it's just absolutely brutal. And then the next 3 months are not fun either. They're painful. It's not fun. It's grueling. There's just nothing exciting about rotator cuff repair surgery, rehab for the first 3 months. It just sucks, really sucks. Versus conservatively, you never go through the excruciating part of the recovery. If you were losing sleep pre-beginning of conservative treatment, most likely that's going to resolve itself after addressing the reasons why it was happening in the first place. So you never go through these 3 months of grueling, not fun at all initial phases of rehab. So you get to skip all that. That's the biggest difference between conservative versus postoperative. Now, let's wrap things up and give you some simple things to try at home or at work or at the gym or whatever you're trying to do if you do have the pinchiitis or the shoulder issues. So the first thing is the most important thing, and that's posture. I know I've talked about this many, many times, but you got to be reminded more than you need something new. So it's the 2-finger posture. You can do this sitting, you can do it standing. One finger from one hand goes in your belly button. One finger from the other hand goes on your sternum or your chest bone. Draw your belly button in towards your spine as close as you can possibly get it to your spine, like you're trying to get into a very tight pair of pants, and keep breathing while you're doing this. As you maintain that position of your belly button pulled in, then you try to elevate your chest up towards the ceiling. We do not want you to lose your belly button pulled in as you're elevating your chest, because then you'll get your chest up by arching your low back. We don't want to do that. When you're doing this correctly, you should start to feel the little tiny baby muscles working in the middle of your back. So kind of in between your shoulder blades, you should start to feel these muscles working. But I don't want you thinking about pulling your shoulder blades back or down or any of that stuff yet. Okay? So this is just for the 2-finger posture. Belly button pulled in, keep the belly button pulled in, and then raise your chest up. That will help you get into the better posture position. Then, once you're there, then you can start thinking about the shoulder blades. You can think about your right shoulder blade, pulling it back and down into your left back pocket, and you can think about your left shoulder blade getting pulled back and down into your right back pocket. So it's just a real slight movement. It's nothing aggressive. The most important thing is keeping the belly button pulled in and raising the chest up. And then that will help get you into a better posture. That should help take some of the stresses off the shoulder pain. And from there, we can start doing our exercises. And then the other simple thing is don't work through pain in the shoulder. If your shoulder's hurting, quit doing it. You got to figure something out. You got to call me. You got to call a qualified specialist. You got to do something. But do not work through shoulder pain. It ain't going to get better. The shoulder, you don't work through pain. Other areas of the body, sometimes you can work through pain. Not the shoulder. All right, this is one of the longest podcasts I ever did, but I needed to be that way. We've got a lot of information. Go back and listen to it again if you need to. Send it to somebody that you know that is dealing with a shoulder issue. Please spread this podcast around. Spread this information around. Let's try to avoid surgery at all costs, but if we need to have it, let's do it. Get it done with. Let's make sure that we're not going to the cookie cutter USA BS physical therapy assembly line crap. You know, it's got to be perfect. If it's not perfect, it ain't doing you a damn bit of good. So I hope you guys enjoyed this. Spread this thing around. Questions or concerns, write them below. Email me, whatever you need. Until next time, hopefully you got me and Jenny next time so I don't have to listen to me boring you the whole time. Have a great rest of your day.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.